Before booking a wet cupping session, also known as Hijama, you should know one thing. It's a powerful therapy, but it's not for everyone. In this video, I'll walk you through who can safely benefit from it, who should be a little bit more careful, and even who should completely avoid it. Hi, I'm Magali. Welcome to the Holistic Cup. Here I'll teach you everything from cupping to complete well-being and share the missing keys to unlock your optimal health. Ready? Let's get started. Let's start by looking into who should try hijama. Because like with any new therapy or remedy, you should look into if it's the one for you. Because I don't really believe in the one solution fits all kind of idea. I know some remedies are perfect for some people and other people should try a whole other approach. And this is also true for wet cupping. You should look into if it's good for you. Although I have to say that the majority of people could benefit from regular hijama or wet cupping sessions. As we live in a world today where we are surrounded by a lot of toxins, just think about pesticides, heavy metals, just to name a few. We could all benefit from a regular detox such as hijama, as it directly removes the toxins out of our body. It supports the body, it supports the organs, and it relieves it from its load. Therefore, it's a great way to support your body to stay healthy and fit. I already talked about the benefits of wet cupping in this video, so make sure you watch that if you haven't seen it yet. Now, let's see who should be a little bit more cautious. People who had recent surgeries, have implants, burned skin, or scar tissue should always mention this to their practitioner, as these are areas that should be avoided during cupping. Another time when practitioners need to be a little bit more careful is when clients are taking certain medications, such as for high blood pressure or blood thinners or for diabetes, because these medications can cause different reactions on a cupping session. But if the doctor gives us approval, then be sure to try out hijama, as hijama can definitely help with some of these conditions. Another group of people are women who are menstruating. So a lot of things are already happening inside the body. There is already some blood loss. There's a lot of stress on the body and hormones are fluctuating. This is why we don't want to put extra stress on the body. We want to be supportive and gentle during that time. Sometimes it can be done if the woman feels strong enough to undergo hijama, or when there's a need for it, such as menstrual cramps that are very painful. Hijama can be done, but we should also look into if dry cupping or moving cupping can be a solution, as they also help with stimulating blood flow. Also, people with anemia should be a little bit more careful. This is the condition where a person doesn't have enough of red blood cells or hemoglobin. So therefore, their tissues and organs aren't getting enough oxygen. Because of this, for people with anemia, we should first look into the hemoglobin and iron levels in their blood. And when these levels are okay, then light hijama can be done, and it can even help with this condition, as it stimulates the body to produce new red blood cells and to increase hemoglobin levels. So it can even help. Women who are pregnant should in general just avoid being cupped or having hijama done on them. Sometimes exceptions are made, but if you want to do this, you should go to a very skilled and experienced practitioner, and it should never be done on your belly or on the lower back area. After labor and during breastfeeding, hijama and cupping can be done, and traditionally it's even used to stimulate the production of milk. And hijama isn't recommended for people with hemophilia. Hemophilia is a rare condition where the blood doesn't clot properly. This can lead to prolonged bleeding after injuries or even spontaneous bleeding. Therefore, it isn't recommended. The same goes for people who have certain wound healing disorders. For example, they can produce too much scar tissue after being wounded. So therefore, also hijama isn't recommended because it could cause big scars. And at last, also age plays a role when deciding to try wet cupping or not. Too young is considered below the age of 3. Then from the age of 70, You can still do hijama, but it should be done with lighter suction. The session should be shorter, and the sessions should also be further apart from each other. From the age of 80, wet cupping isn't very recommended anymore. We lean more towards dry cupping then. Although when the person is still very fit and healthy and hydrated and they get the clearance of their doctor, then they could definitely try it. But it should be very light, very short, and not too often. So I hope today I cleared the issue for you if hijama is your cup of tea or not quite yet. The key is actually to talk with your practitioner. They will be honest with you and they will tell you whether it's a good idea for you or not. And if you have any questions left, ask away in the comments below. See you next time on the Holistic Cup.